Question now rises upon third reading and final passage of House Bill 4108A. Representative Keny-Guyer.
Thank you, Madam Speaker. Colleagues, this is a really fantastic bill. There was a bill that was presented to the House Healthcare Committee last year that was championed by my constituent here, David Keny-Guyer, who's a physical therapist. And what he saw in his work is that Oregon Health Authority, through the Oregon Health Plan, tries really hard to get durable medical equipment out to as many people as possible. But because new equipment like this is really, really expensive, they have to draw the line somewhere and draw very strict rules around who is eligible for what kind of new equipment. So for instance, wheelchairs can only be given out new every 5 years. And yet we know that kids grow really quickly, and it's really hard for, if you fit into a wheelchair at 5, when you're around 7 or 8 years old, it may not fit so well anymore. So we also heard, in addition to demand, many, many stories about seniors and people with disabilities needing durable medical equipment. We also heard that on the supply side, there's a lot of equipment out there that's not being used. It either goes to addicts. Our chair of the Health Committee used to talk a lot about all the crutches that he has in his attic or his basement. It goes to landfills or recycling centers. It often gets sold on Craigslist. But the problem with even selling it on Craigslist is it's a very haphazard way to connect supply and demand. And we don't know if that equipment has been recalled, so there's liability issues. We don't know if it's been refurbished properly or fitted to the patient. And so basically we have a lot of goodwill out there and a lot of different medical closets all over the place. I've learned a lot about them since working on this bill. But it's really hard to get supply and demand and get a whole logical system that works together. So the idea behind this bill, last year our chair asked the two vice chairs, the good representative from Dallas and myself, to lead a task force made up of many different representatives from seniors and people with disabilities, as well as we invited at various stages. Of course, Oregon Health Authority was there, Legislative Council was there. We invited some of the vendors to the table at various times, some of the nonprofits that do this kind of work, and we asked, what can we do, not touching the primary market for now, let's just look at a secondary market. How can we make sure that the equipment that's out there can get refurbished in a responsible way and can get fitted to people who need it? And this would go for Oregon Health Plan recipients who don't qualify for new equipment, maybe because there's a 5-year, rules of eligibility. It would go for people who are maybe on private insurance and it's not covered. It could go for people who are not currently insured, even though we're trying to reduce the number of people on that. So the idea is to do a pilot project, and we thought the only way to kind of wrap our hands around this is to limit it geographically. So we brought in the CCOs and we limited it to, first of all, the Portland Tri-County area, Multnomah, Clackamas, and Washington, and then also to Marion and Polk counties, because we wanted to have some distance along the I-5 corridor. And then once we introduced the bill with a request for $50,000, which is not at all for Oregon Health Authority, that money would go to nonprofits who would set up a database so that we could start finding out where this material is, would set up a transportation system. And then after doing the seed money, the idea is that the pilot project has to kind of carry its own cost. And once Senator Hansel heard about this, there's a very well-known person in a wheelchair running the Clearview Mediation and Disability Resource Center out in Umatilla, and he's like, you could learn a lot if you involved Umatilla, because we've been doing this for a while. So every time we talked about this bill anywhere, there's been tremendous excitement about it. The idea has grown. It's a really exciting way to make sure that we use what is already out there in the community in a responsible way and connect the supply and demand. So I'm really delighted to be offering this, and hoping that my co-leader on the task force will chime in as well. Thank you.